Were you prescribed prednisone for cough? I personally have a cough right now. You can tell my voice is a little weird. So, this question makes a lot of sense for me to address. And I actually get this question a lot. Let me just read one question I was given by Eve. She said, "Why does the med pack never really help me? Been on it about 4 days and still have coughing issues and breathing problems. Doctors don't seem to care that all I do is cough and SOB. I think she means shortness of breath and runny nose during one of those attacks." And this is a really good question because prednisone is prescribed a lot for people who have a cough or bronchitis or a lower respiratory tract infection. But the sad fact is, it doesn't work. So that's why it's not working. It's because it doesn't work. The reason it doesn't really help you, Eve, is because prednisone shouldn't be prescribed for people who have bronchitis or cough. That's the short answer. So let's go a little deeper into why I would say such a controversial thing when clearly people are being prescribed it and why. Why are they being prescribed it? So, bronchitis, which is having a cough with some other symptom, is really hard to deal with. Like, it's miserable. It feels horrible. Nobody wants it. And doctors feel bad. And so they want to give you something to be like, hey, this might help. Problem is that if it's a virus that caused your cough, which most of the time it is, then not only do antibiotics not work because antibiotics only work on bacterial infections, but the prednisone itself isn't going to help. Often, like an urgent care clinic or somebody might say, "Oh, you're having an infection. Here, have prednisone and an antibiotic Z pack," and that combination. But they don't work. They don't help. Neither of them are going to help a viral lower respiratory tract infection. They're just not going to work. So let me tell you why I say that. So in the Journal of American Medical Association, they had a study of 400 people. Half of the people, they gave 5 days worth of prednisolone, which is almost the same thing as prednisone, just a couple molecules different. The other half, they gave 5 days of placebo or a fake pill. So 200 people in each group. And they gave 40 milligrams, which is two 20 milligram tablets. That was the dosage for 5 days versus two nothing tablets for 5 days. When they did that for 40 milligrams for 5 days, there was no difference in how long the cough lasts. There was no difference in the severity. Like they had people write down their symptoms, how awful they felt, and there was absolutely no difference if you're taking fake pills or steroid pills. You felt exactly the same. So it doesn't help. But what it does do is can cause miserable, horrible side effects, such as insomnia, which you really need to be sleeping in order to get over your bronchitis or cough. It can cause weight gain. It can cause hunger cravings. It can cause mood changes, just being really irritable or having like expansive thoughts and feeling amazing, but like not yourself. And issues with relationships because of that. And so that's just a tip of the iceberg of the side effects possible. You could have up to 150 side effects. And I get calls from people all the time who are like, I wish I'd never taken it. It didn't help anyway. And now I have these horrible side effects. Even just one pill is enough to cause anxiety and panic attacks and really disabling symptoms. So prednisone doesn't work for cough or bronchitis, and it can make you really miserable with such terrible side effects. So it's always a question of, do the benefits outweigh the risks? And for cough and bronchitis, taking prednisone generally doesn't outweigh the risks. Except, let me give you exceptions for who it might benefit, who prednisone may provide help for people. And this is a quote from a study, and it says, a short course of oral corticosteroids is appropriate for many patients with acute exacerbation of asthma. So if somebody who has asthma or chronic obstructive pulmonary disease, COPD, asthma or COPD, and for selected patients with peritonsillar abscess. So if like your tonsils have an abscess, like they're so infected, they have an abscess, or severe pharyngitis, like your throat is so sore you can't swallow and it's like super red, a doctor would have to look down your throat with a scope in order to see that. And if somebody has, so it was peritonsillar abscess, severe pharyngitis, or community acquired pneumonia requiring hospitalization. So if you have pneumonia and you don't have to go to the hospital, then you don't need this. But if you have pneumonia and you're so severe that you have to be hospitalized, then yeah, sure, prednisone might help. Otherwise, it says, however, widespread use of corticosteroids in patients with non-pneumonia, lower respiratory tract infection, non-severe sore throat, or low back pain is inappropriate and not worth the risk of rare but potentially serious harms. I completely agree. Problem is, it's being prescribed more than ever before by urgent care clinics or doctors who are like, I don't know what else to give you. And so what else could they possibly give you? So to answer a few rapid fire Q&A questions people might have had if they were searching this, how long does prednisone take to work for cough? It may not work at all. When they compared the two, there was no difference. So it doesn't work for cough unless it's one of those 5 reasons before. What is the prednisone dry cough dosage? It's often about 40 milligrams for 5 days. That means prednisone 20 milligram tablets, take 2 every day for 5 days. But it probably doesn't work. So unless your doctor is like, oh yeah, you definitely should use this for one of those 5 reasons, then do it. But otherwise, that information is worthless to you. Just don't take it. What about if you're still coughing after prednisone? What should you do? So if you're still coughing after prednisone, just like Eve, our person who asked our question at the top, why does it never really help me? Well, it's probably not going to help you. If you have prednisone for cough being prescribed and you're like, is this worth it? It's generally not worth it unless you have one of those 5 reasons. And then what should you do instead? So I actually made a whole video all about alternatives to prednisone for cough. And here's a quick answer. Honey tea is probably one of the best options. And I go through a whole list of things. So check out that video all about alternatives to prednisone for cough because prednisone isn't going to work for cough. Signing off is Dr. Megan, your prednisone pharmacist.